I'm Sadaf Nawal and my roll number is BP 1650192 and I'm a member of group number 50 and my topic of presentation is premenstrual syndrome and premenstrual dysphoric syndrome. So before starting the topic, as the name indicates, this topic is related to the menstrual cycle. So first we have to understand what are the different phases of menstrual cycle. It is consist of major 4 phases. The first one is menstruation phase. It is the day when you get your periods. This happens when the egg from the previous cycle is not fertilized. It means that there is no pregnancy, so there is a shedding of uterine wall. And the second phase is follicular phase. As the name indicates, this phase is related to the follicle stimulating hormone. This is the time between the first day of menstruation cycle when you get your period and the ovulation phase. The third one is ovulation phase. In this phase, there is rising of estrogen levels during the follicular phase. It means that in the previous phase, the level of estrogens are increased. So these will trigger your pituitary gland to release luteinizing hormone. This is what starts the process of ovulation. It means that ovary releases an egg. And the fourth one phase is luteal phase. In this phase, the follicle releases its egg. After that, it will change into the corpus luteum. This structure releases hormones, mainly progesterone and some estrogen. The rise in hormones keep your uterine wall thick and ready for a fertilized egg to implant. And if there will be no implantation, then the menstruation phase will start again. Now coming to our basic topic, premenstrual syndrome and premenstrual dysphoric syndrome. What are these syndromes? This is usually a condition that affects a woman's emotions, physical health, behavior during certain day of menstrual cycle. Its symptom affects more than 90% of the menstruating women. So what is the major cause of these syndromes? Usually the level of estrogen and progesterone increasing several times in the month. So increase in their level can usually cause anxiety, mood swing, irritability. So these are the basic disorders of the premenstruals. Usually these are the symptoms of the premenstrual syndrome. Premenstrual syndrome affects a high percentage of women of childbearing age, with many women feeling mood changes in the day before menstruation. More than 200 premenstrual syndrome has been described as occurring during the days before menstruation, including positive one, but the positive one are very minimum. For example, the positive one are you are able to relax, but the negative one are more. For example, it will lead to anxiety, fatigue, crying spells, stress, irritability, etc. So following are the premenstrual syndrome: mood swings, low mood, increased anxiety, crying spells, and the headache, fatigue, poor sleep, difficulty in concentrating, acne, oily skin, tender or swollen breast, food craving, abdominal bloating, menstrual cramps, decreased libido, and the constipation and diarrhea. So there is a case related to premenstrual syndrome. We have the CP, a 27-year-old female who visits her family physician, and she was complaining of significant mood changes that occur the week before her menstrual cycle. She experienced increased irritability and anxiety, as well as breast tenderness and abdominal bloating. These are the major symptoms which are observed in her. These symptoms usually subside the first or second day before her menses begin. For 2 to 3 weeks after her menses period, CP is at a normal usual routine until the symptoms begin again before her next menstruation. So she is usually uncomfortable with this syndrome, but she is doing all her activity, but she avoids to go out. Her menstrual cycles are regular, and the result of many examinations, for example, pelvic, cardiovascular, neurological examinations, are normal, and all the laboratory assessments are within normal limit. Her serum pregnancy test was also negative. She has no history of an affective disorder. So how we have to control these symptoms, because she is feeling uncomfortable and these symptoms are occurring from last several years. So first, we have to analyze what is the chief complaint. She is complaining of increased irritability and anxiety plus breast tenderness and abdominal bloating. Then we have to make SOAP notes. The SOAP note is usually consist of subjective, objective, assessment and plan. The first one is subjective. In subjective, as we know that our subject is 27 years old female, and the location means she is feeling breast tenderness and abdominal bloating. So the location is abdomen and breast. Characterization: increased irritability and anxiety as well as breast tenderness and abdominal bloating. And the duration of action: onset, for example, she is feeling these symptoms from first or second day, and these are resolved automatically within 4 days of menses. Alleviating factors: she is able to work most of the time, and the history indicates no history of an affective disorder. Now the second thing is objective. In objective, we have to write what are the result of our examinations. Her pelvic, cardiovascular and neurological exams were normal. All laboratory assessments are within range, but she is uncomfortable because of PMC symptoms. So what is the assessment? Assessment will indicate as she is uncomfortable and the symptoms are occurring from last several years, so she needs proper diagnosis and treatment to resolve them all. But first we have to check. We will ask her to complete her nutritional balance. Then we have plan. In plan we have pharmacological treatment. As we know that before going to pharmacological treatment, we should ask her for non-pharmacological ones. So for irritability and anxiety, we will ask her to practice progressive muscle relaxation or deep breath exercises to reduce anxiety. If these will not work, if the symptoms are not resolved, then we will move to antidepressants, usually selective serotonin and reuptake inhibitors. Example, fluoxetine and paroxetine. Okay, these are the first line of treatment for premenstrual disorder if our subject is feeling irritability and anxiety and stress disorders. And these medications are generally taken once daily, but in some cases these medication antidepressants are taken for 2 weeks before menstruation. And the second chief complaint was breast tenderness. So we will ask her to eat a lower fat diet, avoid caffeine. If these two will not work, then we will move to Nsaids. In Nsaid we have ibuprofen, Advil or Mortin should be taken before or at onset of the period. It means that we will ask her to take Nsaid at the first day of period or before that. And the third major complaint was abdominal bloating. We will ask her to eat short meal, little salt, and choose calcium-rich food to reduce bloating. If this will not work, then we will move to medications that are diuretic. Spironolactone can be given to reduce abdominal bloating, taking water piles. What are diuretic? Diuretics are usually water piles that will enable her body to shed excessive water. There should be excessive water loss through the kidney. Then we have prescribed doses for antidepressants, Nsaids and diuretics. First, we will ask her to take vitamin supplements, for example, calcium supplement for anxiety and irritability, and the magnesium one for abdominal bloating. After that, the following medication can be prescribed. As we know that if these vitamin supplements will not resolve her symptoms, then we will move to medications. The first choice, the first line are the antidepressants. We should ask her to take fluoxetine. That should be given 20 mg once daily or 90 mg enteric coated on day 14 and 7. Or we can ask her to take another depressant, that is paroxetine. We should ask her to take 20 to 30 mg once daily. Then we have the second choice, that are Nsaids. We will ask her to take ibuprofen, that is 200 mg, 2 tablets 3 times a day. And the third one are diuretics, spironolactone. We will ask her to take 100 mg daily. In some cases, hormonal contraceptives can be given. Then we have non-pharmacological treatment, that we should ask her first. We should ask her to do dietary changes. For example, in the days of menses, we will ask her to take caffeine-free diet, also rich in vitamin supplements, for example, calcium, magnesium, and vitamin B6. We should ask her to daily exercise. Relaxation techniques are there in order to reduce her anxiety. Psychotherapy, psychoeducation, individual or group counseling should be there, and sport. And the last things are notes. There are no unique physical finding or laboratory test to positively diagnose premenstrual syndrome. As these syndromes, there is no proper treatment, but the treatment that are outlined above can reduce the severity and duration of symptoms, but they are not completely treated. For many women, lifestyle changes can help relieve PMS symptoms, but depending on the severity of your symptoms, your doctor may prescribe one or more medication for premenstrual syndrome. Hormonal contraceptives can be given in some cases, as they will stop the medication, which may bring relief from PMS symptoms. As I stated, the treatment outlined above can help to reduce the severity and duration of symptoms, but they cannot prevent all the PMS or PMDS. Thank you.